Welcome to the Wound Care Center. Here you will receive specialized care for wounds. Stay tuned as we hear more about the center's treatment options and their recent award for Center of Excellence. It's all coming up next right here at Southeast Georgia Health System on Golden Isles TV. Hi, welcome back to Golden Isles TV. We're at the Wound Care Center here at Southeast Georgia Health System. And I'm here with the director and the doctor and a clinical nurse manager. How are y'all today?
Very well.
How are you?
Good. Meredith Riley, you're the director.
Yes.
And Dr. Segerberg,
I'm the medical director.
you're the medical director, and you're a nurse manager.
Correct.
Okay. Thank you for being here. I really appreciate it.
Mhm.
Tell me, let's start off by just explaining to everybody, what is the Wound Care Center?
The Wound Care Center is an extension of the Southeast Georgia Health System's campus, and what we are is a separate center from the main campus that deals with specialized care for wounds as far as advanced forms of treatment. And all the people that are at the Wound Care Center have been trained for difficult wounds, and we have the equipment, hyperbaric oxygen, and the products that are out there to be used to heal wounds.
Excellent. And tell me a little bit about what type of patient might actually seek treatment here.
Well, we have a wide variety of patients that come to us. There's some patients that have trauma, wounds that were a result of that don't heal properly. We have diabetic patients who develop wounds as a result of poor circulation, either venous or arterial, and those people that have difficult times healing those wounds, we have different forms of treatment that can help with that. We also have patients that have received radiation treatments of various types, and we can help with those patients that have complications from radiation using our hyperbaric chambers.
Excellent. So a lot of different, a variety of wounds and a variety of patients can be treated here. Ashley, what health issues, underlying health issues, might a patient have that would prevent them from healing?
So chronic health conditions such as diabetes, venous disease, arterial disease, all that involves blood flow or lack thereof for our patients. Those types of issues can cause wounds not to heal. We have patients with immobility issues, infections left untreated, poor nutrition, trauma. All of those lead to.
And Meredith, can you tell me how a patient might know if they need specialized care?
Sure. So any patient that has a wound that hasn't shown signs of healing within 2 weeks or completely healed within 3 to 4 weeks, then they may need to come to us for further evaluation.
Okay, perfect. Dr. Segerberg, can you tell us what are some of the specialized treatments that are offered here at the Wound Care Center?
Well, first and foremost are the personnel that are involved in taking care of the wounds. Everybody here has had advanced training in wound care to start with, and then with that knowledge, we're able to prescribe various means to deal with difficult wounds. We have various types of products that we can apply to the wounds for accelerating wound healing. We have biologic products that stimulate wounds as far as growth factor is concerned. We have, of course, hyperbaric oxygen treatments, which about 30% of our patients that we see in total will benefit from hyperbaric treatments. And then we have forms of offloading that we can prescribe for patients that takes care of pressure wounds that are created on the foot primarily that allows for those wounds to heal. Pressure is the worst enemy of open wounds, so we have ways of using that to enhance wound healing.
Excellent. So it sounds like there's a lot to offer and actually a variety of treatments here.
Yes.
Ashley, Dr. Seeger-Burbers is talking about various treatment options. Hyperbaric oxygen treatment is one of those options, and we're here in the suite, several chambers right here in this room. Can you describe to me what exactly is hyperbaric oxygen treatment?
Sure. So the oxygen that we normally breathe attaches itself to the hemoglobin in our red blood cells, which are about 97.5% saturated with oxygen. Red blood cells are limited as to where they can travel in the body during hyperbaric oxygen treatment. The patient is at a greater than normal atmospheric pressure, and they breathe 100% medical grade oxygen. The pressurization during the treatment drives the oxygen into the blood through the respiratory system, where it completely saturates blood plasma, and it allows it to carry it up to 20 times the normal amount of healing oxygen to the body's tissues. So hyperbaric oxygen therapy helps the body's oxygen-dependent wound healing mechanisms function more efficiently.
That's great. That's great news, and so many chambers here. So does it help heal faster?
Yes. So the wound beds and tissues are oxygen deprived. So in order to get adequate transport of oxygen, it's pressurized.
So is there anything else that can be treated here at the Wound Care Center?
Well, yeah, they're what we call a category of non-wounds, and sure, we have open surgical wounds and traumatic injuries and various blood vessel issues that cause wounds not to heal, but there's the non-wound category, which are complications as a result of radiation treatments for various types of cancers. People that have bladder injuries as a result of the radiation can happen, and the hyperbaric oxygen treatments can help with that. Patients that have had rectal cancers that have been treated with radiation can develop inflammation of the rectum. This can also be used to treat those patients. Then there are patients with head and neck tumors that have to have a form of radiation treatment, and a complication of that is where the bones in the head and neck area undergo necrosis, or the bones become not viable, and we can help with that with hyperbaric treatments.
So Meredith, let's talk about specialized care and how a patient might know if they actually need specialized care. What is the process that they would go through to actually get here? Is it referral from a physician, or how do they do that?
We can do it several different ways. So patients can be referred by their primary care or by another physician that's already part of their care, or they can self-refer and just call us if they have a question. I think it's important for people to understand that though you may have been living with a problematic wound for quite some time, you don't have to continue that. We can help and help get you on the road to healing and increase your quality of life.
So once a patient gets here, what exactly is the process?
And with wound care, it's really dependent on the type of wound you have. So a chronic diabetic foot wound, you'd be in our clinic a little bit longer than an acute surgical wound.
And that's all, it's based upon the individual and their needs. You have to assess things like infection. So if you have an infected wound, you're going to have to treat that. You know, that will be dependent upon what the bacteria is, stuff like that. So it's really just individualized.
Right, so there's a lot that goes into it. There's a whole assessment process. But everybody's qualified here to do that process and to get you the best treatment possible. Meredith, I know the Wound Care Center is managed in partnership with Healogics. Can you talk a little bit about that, why that relationship is so important?
Sure. We're very fortunate to be part of a partnership between Southeast Georgia Health System and Healogics. As a regional medical center, we want to provide specialized services to all of our local communities. And with Healogics being the nation's largest wound care management company, they can provide unmatched physician and staff training. We have the largest collection of wound data. We have community education opportunities and excellent wound healing and patient satisfaction rates. And so access to all of these things gives us the opportunity to bring this gold standard in wound healing back to Southeast Georgia.
So Ashley, the center received a Center of Excellence award from Healogics. Congratulations.
Thank you.
That's wonderful. Tell me a little bit about that, and what criteria did you have to meet, did the center have to meet in order to qualify?
Our quality indicators for Healogics consist of a patient satisfaction score that is greater than 92%. Our heal rate must be 91% or greater, and our median days to heal a wound is less than 30. So last year we met those goals and obtained Center of Distinction. And because we met the goals again this year, it's 2 consecutive years, we were awarded Center of Excellence.
It sounds like the award 2 years in a row was not just from the hyperbaric chambers, but also from your staff, very well trained. Everybody knows what they're doing and specializes in this type of treatment. And that's so good to know that everything is right here for you at Southeast Georgia Health System. Thank you so much to all 3 of you for being here today. We really appreciate you allowing us to come into the suite, see the hyperbaric chambers, and to talk with you about everything. We appreciate your time.
Absolutely.
Thank you.
Thank you.